Thanks, Tara. Well, good afternoon and good morning to everyone. For the presenters, it's the afternoon. For our attendees in California, good morning to you all. Thanks for joining us today. I am joined by my wonderful colleague, Dr. Tony Salerno, who's going to talk us through the content of our webinar today that really focuses on health and wellness and considering how to manage work stress and build resilience. But before we kind of dive into our webinar, I just kind of wanted to gently remind everyone of the process we kind of established for these webinars. So Dr. Tony is going to walk us through a lot of content, but we do save time at the end and throughout some of the presentation to take questions. So I want to encourage everyone as we go through slide by slide, if you have questions, to feel free to chat them in. We do potentially have a poll that we might use, so there might be an opportunity to answer a questionnaire poll throughout the webinar as well. But we really want to encourage you, if there are questions that come up or comments, that you use the chat box functionality that's on the right-hand side of your screen. We'll be collecting those throughout the webinar, and we will circle back at the end to answer them. The other thing I want to say is that I know a lot of folks who are not with us on the line today had reached out that this is a challenging time in the semester because everything's wrapping up right now, and we so understand that and appreciate those of you who are able to join us in live time. For those who are not able to join on our webinar at the moment, as we do, we are recording this webinar and we're going to circulate it afterwards with the slide deck that we go through. So if you have colleagues who are, teaching today or wrapping up the semester and they weren't able to join us on the line, do feel free to forward them the email and just make sure that they know that although they missed out on the live version of this, we will have a recorded version. So I think with that, I'm going to ask Dr. Tony Salerno to take us through the content on health and wellness.
Thanks so much, Meg, and welcome everyone. So here's a topic that we heard so much about from folks that we were working in the prisons, and really almost everyone that we met during our visits to California, is wanting to take a hard look at the issue of health and wellness, particularly the challenges that individuals like teachers and faculty and a lot of folks in human service work, the kinds of challenges that they encounter, because it's very tough work with individuals who oftentimes are struggling with some very serious issues or going to environments that are really challenging. And so this is really a focus on what we know about some of the prevailing concepts that may be useful to all of you. And it's going to be really addressed from both an individual, programmatic, and system level. So let's get started. So sometimes we may feel like this before work, and occasionally folks might feel another way after work. So just think of those days, and we all have those days, right? And the thing is, you don't want to have too many of these days. And this is like a real challenge to not feel really sort of worn out, both emotionally and physically, when we're doing work, as the work that you guys are doing in a prison environment. So, why should we really spend too much time? I'm going to be saying less, I think, about the idea of coping better with like work stress, and I think that is important. But the idea of looking at the other side of this, which is promoting a sense of really wellness and health. And when you're on the path to compassion fatigue and especially, burnout, which is a more serious kind of problem, because there you've kind of you lost the sense of compassion. Not that it's just working you, that it's wearing you out, but that it's sort of like really fading. Best practices are the ones to go first, right? The attention is directed towards self-management, rather than the work of supporting students. So this was an area that you guys reflected on as part of the organizational decision guide that was labeled Goal 2. If you remember, Goal 1 was really around awareness building. Goal 2 was focusing on the issues related to the faculty's response to this work. And then the third goal area was on practices, right? Classroom management and best practices in educational approaches. And so there were a number of objectives under this. So I just want to remind folks of that, is that there were three aspects to this goal. One is to cultivating awareness and knowledge, and just the idea of making sure that folks who are working in these environments, both new hires as well as existing folks, that they have a better understanding of how sort of day-to-day stressors can impact a person's overall health and well-being, their professional satisfaction, and their professional performance. So that's almost the requirement that folks ought to be educated and their awareness raised around this. The other is organizations that identify problems and solutions. So the degree to which the educational program has a system in place to really explore this, right? It's more than just we'll tell you a little bit about it, but also there's an opportunity to really engage people in sharing their experience, whether it's in a formal way through like a survey of some sort or it's through conversation, right? And that gives you the opportunity to kind of understand what's really driving some of the work-related stresses that folks have. And then the college educational program has a way of identifying, implementing, and evaluating strategies. So what are we going to do about it now that folks are really struggling with this? And a lot of this work, this particular webinar, is going to be on a number of approaches that organizations can consider as well. And then the idea of, prevention is just certainly worth a lot more than trying to cure things, right? So the prevention, early detection of these issues. And so there's a proactive. It isn't like let's wait for people to really get stressed out, but we are aware that this is a vulnerability, and we're not just going to wait and see. We're going to actually be very proactive in this process. So that was just sort of a reminder. And some of you who are on right now may have selected Goal 2, an aspect of Goal 2, to be the main really focus of your improvement efforts. So we do have a question just to see if we can find that out a little bit. To what degree is your team addressing Goal 2 as part of your plan? And so the A would be, well, Goal 2 is really, this is our focus of our improvement effort. For others, Goal 2 is part of your plan, but not the focus. It's kind of there. You want to pay attention to it, but it's really not going to be the driving goal. Goal 2 has been, you've discussed it, but you're likely to address it like later. You put one of the other goal areas as a higher priority. And for others, maybe, no, this is just not part of we're not thinking in this way right now. This is not part of our current plans. So we just ask folks if they could just indicate what's the best answer to that question from A to D. Just give you a moment to do that. And Harry, you let me know when we're ready.
I think it should be ready. Do you see the poll?
I don't see the poll. Do you see it?
I do see it. So it looks like we have 4 participants answering that Goal 2 is part of their improvement efforts. 2 identified B as their selection, and 1 identified selection D as their improvement efforts.
Okay. So right now, it's the folks who are on, at least in today's webinar, because this is going to be archived and recorded, and there may be others for whom Goal 2 is really their main focus. But for most of you, it's part of your plan, but not like the focus. So what you'll be hearing is, I think, some important ideas that you could take into consideration when you're looking at Goal 2 related types of efforts. And so that's terrific. Okay, let's go on to the next. Next slide. Here we go. So why is this really important? And this is both for really the effectiveness of the program, for the system, for California's efforts around this whole thing, is when you have a distressed workforce. And these are the signs, right? You're going to have high staff turnover. Absenteeism, tardiness, that kind of a thing. Going to the environment is experienced really as toxic. And, of course, human beings will avoid those situations. There's a lack of communication, frequent miscommunication between coworkers and or departments. Just the issue of you have more rumors than you actually have honest and reliable communication. There's also people don't get along as well, right? It kind of brings out the worst in folks when it comes to their interactions with each other and really can break down the sense of a cohesive team, that is work and a collegial, collaborative environment. missing deadlines, incomplete work, right? So work performance can certainly suffer. You may have more complaints, right, from folks. And then just a general lack of morale and a negative sort of climate in the organization. And if there's any inkling of doing anything extra, forget it. That's just the last thing on people's minds, right? Because they're feeling already so like worn out. So the idea of, even if it was going to be an improvement, even if it was going to be something that might actually be more satisfying to folks, there's a sort of a depletion of energy that folks may not even pursue that. It's kind of like if you're feeling a little down and you know that exercise could be very helpful, but you're feeling too down to even exercise. It's that kind of thing. And then just a lack of emotional, physical safety, in the environment. So that's why this is like really critically important. Most organizations, corporations in particular, are taking a very hard look at the issue of staff wellness. That is a really critical, factor in terms of bottom line outcomes. And so this is getting a lot of attention really across the board, including settings and human service settings. So what's the range of responding? You guys have seen this, slide, I think, before. But just to kind of remind you of, where we are with this. Certainly the place you want to be with compassion, satisfaction. And people just love their work, right? I just love my work. I really care about the students I'm with. I care about the outcomes. I care about this project. I care about the way this is going to impact our communities. And it's based on a person's value system. I mean, it's really very strong, right? It's a highly motivated, high performer. And then you can have like compassion fatigue, where you're still in it, right? But you're kind of worn out. Then the other is sometimes, just listening and being with people in the presence of people who are really struggling, that it can either trigger things that are similar in our own lives, right? Because we're not immune to the fact of having adversity in one's life, or just the kind of hearing this, the impact that it can have on just being open to listening to some really very difficult experiences. And sometimes they can kind of get into our own heads and can begin to affect us. And that's the idea of that the trauma is not just being experienced by the person I'm working with, but I'm kind of feeling some of those symptoms as well. And then kind of getting to the point where you just kind of burned out, right? And that's a tough place to be. So compassion fatigue, and this is an interesting, I wanted to share this with you because some researchers say, it affects those who do their work well. It means you put your heart and soul into things, right? And you can get worn out, again, if the environment, if the resources, if the supports are really not available, then you can get really worn out with respect to your own sense of compassion and caring for these students that you work with. I must say, in all of our encounters with all of you throughout California, we clearly have come and to learn and to appreciate the level of compassion that people have for this work and the compassion that they have for those in the prisons that they're serving day in and day out, going to a difficult environment many times, and still really being in there with them and caring so much about improving and benefiting those students even more and more. So we definitely have seen a lot of that. But that people can still get worn out with this sense of the more you put in, and if it's continued to be challenging, then you can have that sense of fatigue, right? The vicarious trauma, as I mentioned, is this: you're beginning to experience things like sleeping difficulties, or more increased anxiety about doing this type of work, or kind of enters your mind. Things that your students may have shared with you kind of enters your head, and at times we're really surprised. You could be doing something else, just relaxing, watching TV, being at a party, and all of a sudden you kind of like your brain is kind of drawn back to some of the experience and stories that you've heard. That means that that somehow that trauma kind of narrative is entering your consciousness, right? And something to be just aware of. And then the other, of course, is burnout, when you just kind of have a sense that, look, I don't have a sense of accomplishment. I don't anticipate things getting much better. The worst aspects of it is depersonalization, when you begin to see the students not so much as the reason for your work and the value of your work, but really part of the toxicity of the experience of work. So you can develop cynicism. That's when you're really in a very difficult, space. Diminished personal accomplishment. and especially if you have a sense of high workload. And non-supportive environments is a real risk factor for people to get to that point where they're really feeling burnt out. I'll share a little bit more about what individuals, organizations, and systems can do to kind of lessen the chances that individuals experience some of the most severe negative effects of the work. So what's a program really to do? I wanted to share this with you. It's an interesting kind of two-factor theory around what kind of enhances a person's satisfaction and the kinds of things that actually contributes to dissatisfaction. So it's kind of an interesting thing. Let's just go to the right side of this. What is called hygiene. I don't know why they call them hygiene factors. It doesn't make any sense to me. But what it really means is if you have like lousy work conditions, you're not getting along with your peers. If the leadership quality is just like either absent or they're, that they just don't communicate really very well, or the decisions are made in a haphazard way, the sense of like leadership really is not supporting this work. If the job security is low, if you're being paid less than what you think you're really worth, and then if your status is kind of like a low status in both within the field and, in your community or your friends or your reference group. Well, if those are low, that actually can make you feel pretty dissatisfied. It can actually make you feel very dissatisfied. But if you were to correct all those things, it's not going to make you satisfied unless it improves your motivators. That means jobs where there's a sense of advancement. There's growth opportunities. You can continue to learn and be challenged. We have a sense of achievement when people recognize the work you do, that your task that you do day in and day out, that mostly on balance is very satisfying. It's interesting. It's challenging. It's professionally rewarding. And that you have like a level of empowerment and responsibility and creativity. Those are the motivators. That's what makes people have high morale and feel very committed to their work and experience a high degree of professional satisfaction. The conditions on the right side, which organizations often think, gee, if we just paid people more, they would be more satisfied. Gee, if we just had people just got along a little bit better, they would be more satisfied. Gee, if we gave them a really nice desk and really nice furniture with a window, that will make them satisfied. The reality is, in a weird way, it can reduce dissatisfaction, but it will not increase a sense of satisfaction. All people will say is, I still have a crummy job, but I got a nice office. I still don't like my work. I don't find much meaning. I'm not energized by it, but what are you going to do? I get paid a few extra dollars. I guess that's good. Oh, yeah, I have job security. But you know what? Maybe I would wish I didn't have it because I have security. I got some perks. But unless the work is really gratifying, and this is particularly true for people who choose human service work, where their goal is not the number of vacuum cleaners that they sell, but it has to do with the impact that they have on humans. Now, that's where the issue of motivate is important. So I share this with you so that you, in whatever capacity you have, both now and in the future, that if organizations and systems and programs want to really enhance a sense of satisfaction in the workforce, it's not going to be addressing the issues on the right. It'll be by addressing the issues on the left. Okay? So now let's look at not so much, how do you cope better with being burnt out, but let's look at the core needs that professionals have. And you can say, does this make sense to you, right? And the idea is that what is it that professionals like yourselves really care about? One is people want to really be competent, right? They really want to be skillful and knowledgeable. They also want to be able to have a sense of control and creativity, which is the notion of autonomy. And in my dissertation area was in this area of looking at what are factors that insulate people from some of the most serious aspects of burnout. And this is looking at people from psychiatrists to therapy aides, both in inpatient, outpatient psychiatric hospitals and programs. And one of the insulators, right, one of the factors that really buffered the experience of burnout was the degree of autonomy that people had. So it was, most dissertations you don't find much of anything. It was interesting that in my dissertation we actually found something, and that this issue of autonomy was really important. And the other factor that was important is the tasks that you did day in and day out, on balance, were most of the things you did something that you found enjoyable, something you found interesting, something you found challenging, something that gave you some gratification. So if on balance, you took all the tasks you do day in, day out, that most of the time you were doing things that you found interesting and enjoyable, then that really insulated you against some of the most negative aspects. Even if you're working with very difficult patient populations, which was true in the situation that I was studying. So those are two areas to really pay a lot of attention to. And then feeling connected to others. We really heard a lot from you guys about that. And many of you are actually looking for opportunities to strengthen your contact with each other, your communication with each other, opportunities to get to know and to share with each other. And you're absolutely right on with that. It's a basic human need, and it's something that increases a sense of professional satisfaction and motivation, and contributing to a person's overall emotional and physical, well-being. Okay, so let's now. I'm going to really focus on the issue of your personal responsibility, right? Because even if you're in a difficult situation, it isn't as if you can you need to just sit there and bear it all. Individuals in similar difficult situations, there are some things that some folks do that really helps them to cope more effectively, and things that people aren't doing that really gets them into more trouble. So here's the issue around one's personal responsibility. And what it really relates to is one of the most powerful factors in resilience is whether or not you individually, and each person can ask, I can ask this question of myself, and all of you can ask this question of yourself. If you have an internal locus of control, the sense of, look, I have some control over what happens to me, how I respond to situations, how I try to address problems, that control is in me, that I feel that I am in charge of what's going on and in my circumstances. So if I have difficulties in my work, there's people to go to. There's things that I can do within my area of control. There's things that I can do perhaps to think about this a little bit differently. But the person has this sense that I have my locus of control is internally. Now, too much, of course, can be a bad thing, as that arrow indicates, is that you can find yourself like overdoing that, right? Blaming yourself that everything goes on. If you can't manage it, it must be your fault. And then you take the organization and the environment is off the hook. But that's when you're taking it too far. With the external locus of control, this is really a sense of like, look, whatever happens to me is really not in my hands. It depends what the higher-ups decide to do, or what the prison decides to do, or what my supervisor decides to do, right? There's this sense of, it's really outside of my own control. There's a sense of that even if I think differently about my situation, that it's not going to really change anything. That's an external. A person has kind of given up a sense of having personal, really autonomy over their experience. But if you have too much of that, of course, you just lose a sense of like motivation. It's like a learned helplessness situation. So I wanted to kind of like share that, with you, because it seems to be, out of all the work I've examined in the area of resilience, that individuals who have an internal locus of control fare much, much better than those who have an external. And that's an individual factor. That's not an environmental factor or a work condition factor. That's an individual factor. So at the other individual levels, all to promote competency, autonomy, and really a sense of meaning, which is really what all of you and me and everyone's on the phone and professionals, this is what they care about. So what can you do? So if you want to increase your competence and your autonomy and meaning, here are just some ideas to consider. One is the researching and gathering information related to best practices in the field. That means that individual faculty member does explore the literature, goes back and rereads the stuff that we've given you guys on some of the best practices. They chat with other people. They reach out to others who have some knowledge or experience or expertise in best practices. They develop a plan to implement some new approaches that includes a way to determine, its value. They could explore opportunities to creatively design your own work that's based on sound educational principles. It's within the scope of your work, and it meets ethical standards, and it's something you might want to discuss with others. There's this kind of like self-activation. That's what, if you have an internal locus of control, that's what you do. You kind of say, look, I can do this. I can gather information. I can talk to other people. I can design new strategies. I can test that out. I can also take a look at the alignment between my values, and my work. That has to do with really like reflecting on the way you perceive your job and perceive yourself within that context. Developing some realistic goals in light of your day-to-day realities. Sometimes, having expectations that far exceed what would be possible, really, and realistic in light of the day-to-day realities just leaves people very frustrated. And then having a really honest self-awareness of your prevailing attitudes, your feelings, your beliefs, and your expectations that may support or hinder your resilience. So those are things that really are decision points for individuals, and I think it's important to recognize that. Now, when we shared with you some of those resiliency factors, like if you wanted to for yourself, or for a team wanted to, or is it one of your plans is, let's just take a look at how we size ourselves up with respect to our own resilience. And some of those factors include how we go about making informed decisions. To what degree do we engage in self-care and kind of just managing our emotional life? How do we strengthen social support? What about our way which we approach problem solving and taking action? What about the thinking? Thinking is such a critical factor here because there are ways of thinking about your work and yourself within your particular environment that is going to trip you up, that's going to decrease your sense of morale and control. And there are other ways of thinking that maintain your morale even under circumstances that are challenging. Having a sense of personal confidence and self-efficacy, that's the locus of control issue. And then really recognizing personal meaning, even under difficult situations, to not lose sight of the important meaning of your work. So these reside within individuals. And, we shared with you the Tony Salerno's not so famous resiliency scale. And some of you might actually want to do that to kind of get a sense of where you are with respect to some of those resiliency areas. And as I mentioned, some of those areas will tell you, well, where am I with the area of self-care and emotion regulation? How about strengthening social support? It can kind of give you a sense of where your strengths are with respect to resilience, but also maybe give you some hints about areas that you might want to personally decide that that's going to be an area you're going to work on. Now, there's some of the research I wanted to just share with you is these are the typical emotions that are really associated when a person's resilience is really lacking, when it's been so challenged that it's kind of broken through, right? So if you're experiencing like anger and sadness and depression, guilt, anxiety, embarrassment, some of the research is that these are sort of indicators, right? And especially if this is kind of chronic kind of experience, right? We all get pissed at times. We all get sad and depressed. We feel guilty about things. This is just part of human life, right, as being a full human being. But when there's sort of this chronic, pervasive, persistent type of experience around this is where your kind of coping strengths, for all of us, if this is what we're experiencing, as really being reduced significantly. And there are some sort of models and approaches in this whole area of positive psychology that might be interesting to some of you who are on the line. And there's this thing called the ABCDE model, right? So for one important key to like building resilience. And the first thing is sort of recognizing, adversity, that you may be thinking or approaching things in a way that may not be as gratifying to you as well as to those that you work with. So this notion of having an honest self-appraisal, of recognizing particular ways that you think about the work or go about addressing the work that can actually trip you up. Beliefs, right? Finding the true reason behind some of these kind of emotions, like what's really behind my experience of like sadness, right? Or my experience of like embarrassment or feeling, pissed when I'm in a situation in working and all, or dealing with my coworkers or leadership or whatever it might be. Then recognizing the consequences, the negative impact of these emotions, and then really learning how to kind of like challenge that, really kind of saying, look, this is the way I'm sort of like thinking, and instead of just kind of viewing it as, well, this is the way I guess I'm always going to think. It's really being able to challenge some of those thoughts and then begin to choosing a new and more effective course of action. This is basically when it comes to if an individual say to me, well, listen, Tony, what is it that I'm going to need to do, within my own kind of control and within my own kind of, way of experiencing the work and the environment that I'm in. These are just some strategies that individuals can engage in that really associated with building some, resilience. And then, again, this is not for the individual, it is really developing your own personal resiliency and wellness plan. And what that really means is figuring out what you need to keep doing, start doing, and stop doing to support your ability to stay well, reduce the harm associated with work-related stresses, and really being able to more successfully handle not just what you're dealing with now, but things that you're likely to deal with in the future. This is just true for us, all of us who are working in challenging settings. So what about keep doing? So you can ask yourself some important questions. Who are the people in my life at work that help me to stay well and build resilience? And strengthening that is a keep doing kind of approach. What places do you spend time in that support your wellness and helps you to build resilience and to continue to do that? Activities, not to let them slide or to kind of ignore them, but to kind of recognize, gee, this is part of my overall wellness. These are the kinds of activities that I engage in that helps to keep me healthy and well. And what ways of thinking keep me from moving forward? And that's sort of like a tough one, right? The idea of your thought processes. But that's a way of thinking of developing sort of a wellness plan that's in your control outside of what the environment. We'll get to some of the things programs can do as well. And then, of course, things you stop doing, right? So what are relationships that really causing you more harm than good? What places do you spend time in that causes you, again, more harm than good? Activities that may be causing you more harm than good. I was looking at some research, and this is with social workers, around the kinds of strategies that they use to cope with some difficult situations in human service work. And there was a good percentage that basically just was very honest in saying, is I drink, right? I drink alcohol. Some were using prescribed medications. Many were using more health-related types of approaches like exercising, talking to friends, having a relationship with their supervisor that was very, very positive. And those were, healthy sort of like strategies. But there are things that people might be doing. It's really causing them more harm than good. This is not a process that the organization can actually do for you, but it's something that an individual can begin to reflect on. And actually, this is a conversation folks can really think about as part of their team. This is actually something organizations could, right, create an opportunity for people to spend some time reflecting on some of these things and sharing it with each other as a team. And then things you could start doing, right? Same idea, relationships, activities, places, and ways of thinking that is likely to move you forward. So those are kind of things for the individual level. But now let's go to the team level. And there these are the kinds of things that programs can do. That's gather information about the scope, pervasiveness, intensity of burnout, right? Compassion, fatigue, vicarious trauma. Programs can educate the workforce about the signs and symptoms of burnout, et cetera. They can develop a year-long plan to improve the health and wellness of faculty and staff and get buy-in from those who can make it happen, right? Consider reviewing the managing set of slides that we had shared and the communicating for buy-in guide. That's something that, again, a team can decide to do. And then the idea is to assess the strength of resilience in the workforce. And that was, you can consider my not-so-famous resiliency measure. I kind of pushed that only because it was not designed as a research instrument, but it was designed to really identify those items that are more likely to be changed by an individual, rather than some of the resiliency scales that are out there. But if you were interested in some of that, you can reach out to us and we can share that with you. So these are the kinds of things that teams, can actually do. And we do know that there are some who are actually doing it. So if you recall, we shared with you the professional quality of life scale that's available to you. That's if you're interested and a team is interested in, look, let's just find out where we all are with respect to burnout, vicarious trauma, and compassion fatigue. This is an instrument that does that, and we know that some of the teams out there are actually using it. Other things the team can do around competence, autonomy, and meeting to discuss best practices, having a meeting agenda that includes best practice improvement discussions. Team members engage in knowledge acquisition, going workshops, webinars, modules, podcasts, followed by professional development strategies, right, designed to support faculty. So that's where you have team learning, where people come together to learn information and then discuss how they can apply that information in the work that they do. The faculty voice, choice, and involvement, right, your perspectives, your opinions, your expertise are actively sought and seriously considered. That's things that programs can do. Create that kind of environment. Plan visits to other similar programs. That's what a team can do to, again, broaden their perspective and reaching out to others to increase their sense of competence. It's an autonomous type of thing and builds a sense of meaning. The recruitment and onboarding process can be highly transparent and really looking at the qualities it takes to be successful and satisfied. Other things, mentoring and coaching, especially for new hires. Focus on ways to enhance recognition and reinforce accomplishments. Team building, the idea of developing high levels of trust, resolving conflicts, increasing commitment to work, holding each other really accountable, and paying attention to sort of the results. Problem solving, right? Taking a look at one's policies and procedures and processes that are really more aggravating and something that can reduce burden on the faculty and at the same time improve outcomes. And then having supportive, reflective supervision, individually and groups. Now, this is one issue. In the human service work that I'm very familiar with, and we at McSilver in mental health services, substance use services, the inclusion of supervision, which is just that each person has someone that they can kind of go to and really talk things out, share what some of their challenges are, that people reach out to them, want that kind of information. So if you're not struggling alone, you're not struggling in silence, you're not struggling and thinking, gee, I'm supposed to be able to handle those things, and no one really wants to hear about this, and the climate isn't one in which people come together to really share with each other the challenges that they have. And the notion of reflective supervisory situation, and here again, it's just really focusing on a lot of support, more like being a teacher and a coach, following up regularly. This notion of paying as much attention to the emotional experience of the faculty and teachers as you do to their actual task performance. And that's what a supervision. Now, you guys may not refer to it as supervision, but the one thing to always kind of consider as part of the team and with leadership, and there's also such thing as peer supervision, where people can kind of go to each other and creating that climate where people feel that they can very honestly share what their experiences are and what their challenges are. Okay, I think I pretty much made that point with this. Okay, so now I want to so we talked a little bit about this addressing health and wellness from the individual perspective. Then we talked a little bit about what programs can actually do, but that's not the whole story. There is a role for system level as well to promote the competence, control, and sense of meaning, or the autonomy actually, for the workforce. So here I just want to share that with you. So policies and related funding that expects and supports ongoing professional development and responsible creativity, where a system has ongoing training and education built into all educational programs. And it's really promoting a culture of innovations and excellence. So that's sort of just to be aware of this is not necessarily under your control, but it's important to acknowledge that there's a contribution from both you as an individual, the program level, and the team level, and then also the larger system across California. And not just California, it's really across all systems. This would be as true in New York as it is for any other place. Promoting interactions and contacts across prison faculty and staff. We heard this a lot. People really enjoy meeting their counterparts, right, from other prisons who are sharing some of the, had a lot of shared experience, right, and having an opportunity. This whole project, right, of sustaining futures is a system-level response and a system-level strategy to address and increase a sense of competence, autonomy, and meaning. And so here's a perfect example of it. California's doing it. Can't say they're doing it in New York or other states that I'm aware of, but that's a very specific example. At the system level, there could be, and I understand that there is some systems in place around this, creating an interactive learning management system, a listserv, and other platforms so that you and others can share information, engage in collective problem solving, and really explore best practices in teaching. So that's the notion of, can you create a connection among all the folks who really have a shared experience and shared challenges and shared goals, really related to promoting best practices within a prison environment. Frequent and accessible information relevant to the workforce, where there is information provided around the successes in the system, the accomplishments, the challenges, the plans, the supports, and resources. So that really has to do with ensuring that people have the kind of information they need to do a really good job. And then frequent and honest check-ins with program administrators, faculty, and staff. And this is really, requires driving out fear, so that there's a way for at the system level for the experience of faculty and staff, that experience and that information to get to those who are at very high levels of decision making. That's a system level kind of approach. And actually, Sustaining Futures, this whole project of Corrections College and all, this is like really a system level kind of response, and it's really important to acknowledge it. It isn't as if this is kind of going on all over the place. And the fact that the system brought us in from McSilver in New York to kind of support and to be a resource to all of you, to engage in this community of practice, that's a system-level intervention, and it's a terrific one. And that, again, it's designed to promote competence, autonomy, and a sense of meaning. Other things is creating an easily accessible resource guide to best practices in adult education in a prison environment that addresses critical issues. We've heard so many critical issues. And yet, one of the issues or challenges is, can some of these things be codified in some way? Can we create a kind of a directory or a repository of information or a guide or a handbook or something where a lot of these issues that people raise over and over and over again are able to be addressed, that provide some guidance to faculty, particularly new hires, right? And that has to do with the guiding values and vision, the ethics, professional boundaries, ways of handling that. We hear about that all the time. And it isn't as if each prison or each team has to kind of figure it out on their own. There ought to be some best practice standards around issues related to professional boundaries, around understanding the prison environment, so people are better prepared, right? What are the best educational practices, all the things we've talked about around the grounding kinds of exercises, ensuring that there's a lot of choices in the classroom, and the assignments and the teaching, ensuring that people can kind of build and go with their strengths, ways in which people can end a lesson so that people feel better prepared to enter a prison environment, which is very different than the culture you're creating in your classroom environment. Around faculty, all the things we've been just talking about right now, faculty health and wellness, including that as part of it, understanding trauma and resilience. So that's at a system level of creating a resource that can be accessible and provide guidance for organizations and teams. Public relations strategies to elevate the importance of your work, because you're doing tremendous social, really work in the society community. And when there's a lot of good public relations around that, that elevates your status and your prestige of the work that you're doing. And then a system level to monitor signs of workforces, a workforce that's in distress. All of those things that I had mentioned at an earlier slide around, the idea of turnover, on the idea of absenteeism, around low morale, all those sorts of things at a system level, having something in place to kind of monitor and keep one's hand on that pulse, so that, again, you could be more proactive than just, oh, my God, we have a terrible crisis, no one's showing up to work. That you're having problems recruiting people and all this kind of stuff that can go on, which is human nature. We wait for a horrible problem to occur, and then we attend to it. But a system-level proactive approach is a much more effective one, of course. And then the last piece I just want to share, we'll have about 10 minutes for questions and all, is really addressing and understanding a person's physical well-being. I've been involved in projects around integrated care, which means bringing health services into both mental health programs and substance use programs. to not separate those things, right, to bring health in there. And the big push is really on creating this culture of like wellness. And what it really means in many ways is to recognize that when you improve and support an individual's physical health and well-being, you are in effect improving and supporting their emotional well-being, you're improving their resilience, you're improving their ability to cope more effectively with work stressors, physical illness, physical fatigue, complaints, physical pain, the stresses, fatigue that's related to physical problems, all of that, right, all of that puts the person in a much more vulnerable state to cope more effectively and to engage in high performance. And so that's another area. So at a systems level, to what degree, that those physical health needs and emotional needs are addressed in some way, whether that's an employee assistance program where you build in some supervision piece. That means someone you can really talk to when you're struggling with issues, really looking at work-life balance, accommodations. The other is the physical health issues, and I've seen this in a lot of organizations that do health screenings, flu shots, smoking cessation programs, arranging discounts at local wellness support like at YMCAs, Weight Watchers, or whatever, gyms and things like that. Others are providing incentives. We've seen organizations using incentives to help people to reduce and eliminate tobacco use, improvements in weight management, nutrition. You get it, right? You get it. This whole area of at a system level, or even at maybe college level or in program level, where there's an attention and recognition of the importance of addressing a person's physical well-being as a very important approach to strengthening a person's emotional well-being and their overall resilience and performance. Okay, so here is just some resources, but let's get to some questions. So has anyone typed in any questions?
Hi, Tony. So this is Meg. I actually have a question that has been asked on some of our consultation calls, and that really kind of, I think, has been echoed across different colleges and teams, and that's really kind of getting to the issue around boundaries in wellness. And I think some folks are curious if you might have any information to share around how boundaries and maintaining healthy boundaries can help or contribute to wellness.
Yeah, I mean, this is an issue that's also come up when we were, meeting in the face-to-face, training. And I think, in some ways, it isn't like as if I have a nice pat answer, for that. I think that this is a process that teams should engage in, to really think about this in a very, very thoughtful way. The principle in most professional work is the idea of avoiding dual relationships, so that you're not shifting from, I'm a teacher today, but I'm also like a friend tomorrow, and then I'm a confidant another day, and now I'm a counselor. There are elements, of course, of teaching, that professional role of teaching, which does mean you want to know what might be some of the emotional barriers that's interfering with the person studying or remembering or being able to concentrate or completing assignments. Of course, and I was a high school teacher for about 6 years, so I get that. And I taught in college, I taught at graduate level and all that kind of thing. So it isn't like you cannot pay attention. And also you want to create a friendly, warm environment to folks. But that's different than establishing like sort of a friendship relationship, which is reciprocal, right? Which is reciprocal. Here it's the primary, and it should not be confused, that the primary role is I'm a teacher, you're a student. And there are certain expectations in both of those roles. We're both accountable to each other in ensuring that we sustain that role and that we relate at that level. Now, that's a guiding principle. When it comes to actually thinking about what standards we'd want to put on paper and that we might want to accept as a standard that we want everyone to employ across the system, I think that that's a wonderful exercise for folks to get together. They could talk to other places, other prison environments, ask them what they do. I think that's a very exciting and interesting creative process, rather than, Dr. Salerno thinking he has like a very nice, pat, expert answer to this question. So that's really how I would approach it, Meg.
I appreciate that, Tony, and I think that makes a lot of sense. And I think it will echo and resonate with a lot of our colleagues who are, asking these questions and thinking about this in terms of their core implementation team.
Yeah, and I think, many ways not to subjugate your own expertise is that they have a lot of, one thing I want to say to all the faculty and teachers in the prison, I haven't taught in a prison. That means you're an expert in what the realities are, what the challenges are, what the conditions are that really helps to influence the degree of professional boundary management. That's the expertise, right? And so I think folks coming together, I have no doubt that they will be able to formulate a standard of practice related to professional boundaries that would be thoughtful, that would be responsible, that would be respectful, and would actually promote better outcomes and a safer, classroom. I absolutely believe that. Would be a wonderful task for any team or across teams to kind of think about that and actually having it codified. That's why when we talk a little bit about the creation of a resource guide, because I know there are some teams that actually are looking at that. And I think that's really terrific. And I think that is true for professional boundaries as well as other issues that come up in a prison environment.
Definitely. I also know that at the end of this project, we are going to be accumulating all of our resources and tools and the slides and webinars into a consolidated toolkit. So we'll have all this wonderful information in one area that we'll work with our colleagues at our Corrections to College colleagues on posting it and making sure everyone knows how to access that. Which will be helpful to everyone. So I think we still have a minute or two for any other questions. I don't think we've had any other questions chatted in just yet.
If people want to make a comment, either a comment or a question, that would be great. We just give it a minute, and if not, then
we'll give it a minute.
Yeah, just give it a minute, and then we'd love to hear either a question you have or a comment that you want to make or a reaction to some of the information that you've heard.
Let's see here. And maybe, you know what? Let's see if, I know there's about 15 folks on the line at the moment. Tara, do you think you'd be able to unmute people just to see? I know sometimes it takes a while to type in a question. I know we were limited on time, so maybe if we can unmute the lines. I know this is a complete audible. I did not prepare, Tara, that we were going to unmute the lines. So if we're not able to do it, I totally understand. But just thinking that it might be easier if we open the lines for folks to talk if they have a quick question or comment.
Okay, I'll work on opening up the lines, but we did receive another question.
Okay.
They asked, do you have any insight on how we might be able to alter our teaching to help our students with triggers?
Could you just repeat that again, Tara? I didn't catch that all.
Sure. So they asked, do you have any insight into how we might alter our teaching to help students with triggers?
Yeah. Well, I think in many ways it's the all the things we've been really talking about. One is the notion of grounding. So what triggers people? The kinds of things that we know that are triggering is when people don't have enough space. This is what happens to individuals who've had significant adversity. So looking at the calmness in a particular setting, regularity, having structure and routine is important so that things are predictable. People don't have to worry about how this is going to go today. That's very, very helpful in terms of minimizing some triggers. The grounding is one of the most important ones where you're trying to just reduce strategies to just reduce emotionality is very helpful. Being very prepared for your class, believe it or not, the idea that, when a person perceives the teacher as they really have this prepared, they've laid it out, I know exactly what's going to happen in this environment, that is very, very reassuring and helps to reduce any sense of triggers. At the interpersonal level, certainly anything that is viewed as being critical or judgmental, or there's a harsh tone of voice, of course. Those are very sort of common things, which I think you guys are very, very attentive to those sorts of situations. And then just always, in many ways, the issue is to be very cognizant and aware of the students, right? So if you see someone who is particularly seems to be withdrawn, and that would be something to just keep in mind and an opportunity to kind of check in with the person. If you see someone who seems particularly antsy or a little kind of like restless or anxious and stuff, a place to kind of see if you can kind of check in with that person. Because people have different sorts of like triggers and triggers that you wouldn't even know unless the person was willing to kind of like tell you that. But anytime you reduce distractions, noise level, the lighting is good. I mean, it's all the kinds of conditions where a person can feel safe and can feel comfortable. Those are the kinds of things that in classroom management helps everyone to kind of reduce the potential around triggers. Giving people choices in terms of their assignments, so more that a person has some control, rather being asked to do something, especially if they feel that they don't know how to do it. So those are some of the things. I think some of the things we kind of shared with you, in the during the trainings. So there isn't like a single thing that you can do, but it's really creating that kind of like safe environment within the classroom and managing in the way we described.
Thanks so much, Tony. I know that it does look like a few folks are typing in some more questions, but unfortunately we are over time for the webinar today. So what I'm going to ask, if it's okay with you, Tony, is if folks want to email in some more questions, I will be happy to collect them and sit with Tony and kind of look through them.
Sure.
So if there are questions that didn't get answered, Tony, does that work for you if we take that approach?
Please,
cool.
Don't hesitate to send questions in and we'll get back to you.
Yep, and you can email those questions to either myself, this is Meg speaking, or Tara, or Kelly, and we will make sure that we pull all of those together and get those answered. So again, I want to thank you, Tony, for walking us through all of this. Thanks so much for your time and expertise in sharing this information. And again, thanks for reminding ourselves and our colleagues on the line that we are also experts in understanding our work and the particular niche that we are in teaching inside prisons. So I want to thank everyone for joining. And this, again, is going to be recorded. We'll circulate it, and we'll circulate it with the slides. And feel free to reach out if you have any other questions or concerns. And we hope to be in touch with everyone soon on your next consultation call that we'll be having with your team over the next couple weeks. So thanks again. And Tony, do you have anything else?
No, I just want to just appreciate very much the work that you're doing. This has been an incredible partnership with McSilver and all of your programs, and we're continuing to look forward in supporting you, and then meeting again in September, which I think will be fantastic.
Thanks, Tony.
Take care, everybody.
Bye.
Bye-bye.